Alright, my name is Daniel Lewis, and I'm going to demonstrate how to do a IM injection in the deltoid. So the first thing I'm going to do is verbalize the 6 rights of medication administration, which is right patient, right medication, right dose, right time, right route, and right documentation. So I'm going to perform hand hygiene. Alright, so now I'm going to check the doctor's order in the MAR to see what it is. So this order is for a Pneumovax 1 milligram IM now. The vial that I have here contains Pneumovax 2 milligrams per milliliter, so I'm going to be doing a half a milliliter injection. So first thing I'm going to do is check the vial, make sure there's no cracks, make sure the expiration date is good, which this one is. So I'm going to open up a alcohol pad and clean the top of the vial. Next, I am going to get my syringe and needle out. For this, I'm using a 3 milliliter. I'm supposed to be using a 23 gauge, but the only needle I have is a 22 gauge, so that is what I'm using. So I'm going to attach the needle and uncap it. So let's see, again, I need a half a milliliter, so I'm going to pull out a half a milliliter of air and inject that into the vial, making sure that I don't put the air into the medication itself. And then I'm going to pull back 1 milliliter of medication. And I have a little bit of an air bubble. Alright, here we go, 1 milliliter, or half a milliliter. Alright, and then at this time I'm going to recap the needle. Okay, so I'm going to put this away. So now I am going to be going to the patient's room. So what I would do first is I would knock, introduce myself, do hand hygiene. I would ask the patient to state their name and date of birth so I can make sure that I have the correct patient, ask them if they have any allergies. Next thing I'm going to do is if they're laying down, I'm going to have them either sit in a chair or I'm going to sit them up in the bed, and I'm going to completely expose one of their arms. And what I'm going to do is find the acromion process at the top of the shoulder and do 3 fingers. Right at the bottom of the 3 fingers is the spot where I'm supposed to be doing the injection, right into the deltoid muscle. So after I do that, I'm going to go ahead and put on clean gloves. So I will take an alcohol wipe and I will clean the injection site in a circular motion, starting at the center and working my way out. And I will allow that to dry. While that's drying, I'm going to go ahead and uncap the needle. It's still wet. Okay, so now that I have my place on the patient's shoulder and I know exactly where to do it, I'm going to use my thumb and forefinger to kind of pull the skin taut, and I'm going to insert the needle at a 90-degree angle all the way. And before, I'll move my index and forefinger in my non-dominant hand, and I will aspirate slightly to make sure that I'm not in a vein. As soon as I know that I'm not in a vein, I will start injecting the medication slowly over the course of 5 to 10 seconds. And then I will pull the needle out and put the safety on. and then I will immediately put that in a sharps container, but I don't have a sharps container here at home. At this point, I will grab a cotton ball and blot it, and then put tape or anything like that over top of it, and apply light pressure to it while that quits bleeding. Next, I would go out into and document in the MAR what medication I gave, the dose, and the exact site that I did the injection at.